Great. So hi, everyone. And on behalf of ELNET and Startup Nation Central, I would like to welcome you to this video conference. We have already more than 100 participants from 16 countries, including members of parliaments, mayors, health officials, health professionals, members of the startup community, members of all kinds of governmental organizations and journalists. So welcome to you all. We will be discussing and exchanging knowledge on how innovation has been impacted by the current crisis and how innovation and new technologies can help to contain the virus. And it is extremely important to share our learnings and approaches and contribute to enable new technologies to be useful, answering real needs in so many areas all over the world. So this conference will be divided in two parts. The first part will be the speakers and expert part, and I will be its moderator. And the second part will be dedicated to the presentation of 4 very innovative companies. And this part will be moderated by Emma Vordimon from Startup Nation Central. Regarding the first part, we will have 3 speakers, and I will present them shortly. So our first speaker will be Professor Eugene Kandel, the CEO of Startup Nation Central. Professor Kandel serves as head of the National Economic Council in the Prime Minister's office and as economic advisor to the Prime Minister of Israel between 2009 and 2015. Professor Kandel is also the Emil Spire Professor of Economics and Finance at the Hebrew University of Jerusalem. Thank you for being with us, Professor Kandel. Our second speaker will be MP Thomas Jarzenbeck, member of the Bundestag, the German parliament. MP Jarzenbeck is the German Economic Affairs Ministry Commissioner for the digital industry and startups. And he is also served as the federal government coordinator of German aerospace policy. Thank you for joining us, MP Jarzenbeck. And our third and last speaker for the first part will be Professor Christoph Herborn. Professor Herborn is the Chief Medical Officer of Asklepios Kliniken, the largest private clinic operator in Europe, with more than 150 medical facilities and 2 million treated patients. So now, before I give the floor to the first speaker, I would like just to say that since we have a lot of participants and we need to keep the timeline that we set for this call, I will be asking from all the participants during the Q&A sessions to formulate short questions, actually only 1 question per person. And the speakers will try also to give brief answers. If we see at the end that we cannot give to everybody, including the journalists, to ask all the questions they want to ask, we will be able, after this conference, to organize private interviews if needed. So, Professor Kandel, the floor is now yours for an 8-minute speech on your topic will be worldwide repercussion of COVID-19 on innovation and processes and challenges. Please, Professor Kandel.
For some reason, I can't be unmuted. It's okay.
All right. All right. You can go ahead.
Great. So first of all, allow me to say that it's a privilege and honor to partner with ELNET. I'm just going to share the presentation, but in the meantime, it's an incredible opportunity for all of us to actually try to see how we can all share the best practices and insights and learn from each other. And this is a great example of how, you know, by working together, we can all succeed a bit more in winning this battle and actually coming out stronger at the end, which I believe is the case. So I'm going to talk a little bit about sort of the challenges of the innovation ecosystem in Israel. The first thing that we need to understand is how do we see the day after? And the day after we see as some good news and some bad news for us as an exporting economy. We believe that the world will become somewhat more protectionist. The globalization is going to be probably a bit taken back. So for the Israeli export economy in general, it's not a great news. But we believe that our main markets, the US and Europe, are likely to stay open to us. So we hope not to be hurt too much, including, of course, the Israeli tech. There is going to be two things that are going to be actually going for us. Is that one of them is the dramatic changes in everything we do, whether interpersonally, in terms of work, in terms of how consume leisure, healthcare, etc., will change quite dramatically, because we have been shown that you can do things differently. And so this represents opportunities for technological innovators all around the world, among them Israelis. And so areas like AI, cyber, digital health, edutech, and Industry 4.0 are going to benefit from it. Industry 4.0 specifically because the shortening of localization of supply chains that is likely to happen, because countries are less likely after this event are going to be for outsourcing their vital supplies to other countries. That would require making manufacturing much more efficient, because the manufacturing costs are likely to rise. So that will bring much more demand for Industry 4.0 solutions, which we've been dealing with for a few years now. So focusing on Israeli tech, just a basic background. 2019 was a record year for Israeli high tech. In terms of any parameter that you look at, has grown tremendously, $8.5 billion overall investments in venture capital, which was a 40% jump from 2018. And then suddenly it all collapses, because 85% of this money was coming from overseas investors, overseas funds. And so these funds are gone for now, and are likely to be gone for about a year. So the main effect, the short-term effect on the Israeli innovation ecosystem is actually liquidity crunch. And so in addition, of course, there is a, depending on the sector you're in, it could be either plus 100% increase in your revenues, as some companies will talk about it, or 100% decline in your revenues. So there's a huge variation on the impact on the demand side of the world on various sectors. Majority, of course, are hurting. What the liquidity crunch is doing is that it means that the local investors, which are left to hold the bag for a while, are going to be rationing their funds over longer periods of time, and they will have to start investing less in new companies, culling some of the portfolio companies that about a month ago they thought were very good, and cost cutting in the rest. So which all of it means layoffs and much lower readiness for the future competition, future challenges, if we come out without any intervention of the government. There is a debate in Israeli press and Israeli sort of public discourse about whether this industry needs or deserves, in some sense, public funding to help it weather the storm, and it's not particularly politically popular. We've been arguing that it's an incredible opportunity, actually, to invest small amount of public money to benefit greatly. And the reason being is that at this particular time, this particular industry is very different than any other industry and at any other time, because there is a possibility for the government to co-invest or cause others to co-invest with managers who are very, very critical of this industry and are only investing in companies that actually will be expected to make money. So you don't have the adverse selection of bailing out companies that will fail at the end. That on average, if by co-investing, you solve the adverse selection problem. And since the government is getting very large percentage of these investments in terms of taxes on wages, it is going to actually benefit greatly, because its net investment or net support will be much, much smaller than the private investors with whom it's co-investing, and yet the benefits will be the same or even bigger. So the Israeli government is planning, we've been sort of arguing for this, but it sort of goes, I believe, in the right direction, despite the populist criticism, is that for small companies, the basic focus now is the runway increasing grants. So the company has to have a good technology, and it has to have enough runway so not to fail in the short run, but not enough runways to withstand 18 months of operations. And so the government authority here actually did something quite impressive by shortening the time of approval from 3 months to 3 weeks for these companies. The medium-sized companies is something, the government is doing something innovative. What it does is actually giving institutional investors, rather than investing on its own, gives institutional investors downside protection for their investments in the next 12 months in this industry when they are co-investing with someone who knows what they're doing, either in debt or equity instruments. Only the public money is downside protected, not the professional investors' money. And so that does not distort the incentives of the private investors to invest in these companies. So that is very, very important. And so the government, in some sense, you can think about it as the government sort of taking its huge returns and sharing them with private investors, with institutional investors, and in some sense, sharing the benefits. And by doing that, inducing them to invest. The second, and the last one, the large firms, there's a variety of debt instruments with some downside protection through various banks. So like European Investment Bank has similar programs. They just it's somewhat differently structured, but it's no different than many other countries are doing. There are additional opportunities for the government that are maybe in the next couple of months when they finish the first package, is that one it has to be understood that many people are idle in it, so the opportunity cost of their time is very low, and the future for many of them is very uncertain. A lot of them lost all their human capital. Think about people in travel industries, people in a variety of industries that are not going to come back anytime soon. And these people need reskilling, they need upskilling, even high-tech workers need upskilling, and the college students that are still idle and cannot really get jobs now can be better prepared for the job market. So they not only know theoretical stuff, but also. So this is a very, very important part. There is a great opportunity of modernizing the government and assisting tech at the same time, sort of bringing them together. And finally, I believe that if this crisis taught us anything, is that we have to be much better prepared for the next crisis that may come, whether it's going to be epidemic or something else. And technology needs to play a much bigger role in that. So this is a great opportunity to learn. And we're trying to work with the government to figure out how to do that. So the last thing that I want to say is that some resource on what is going on the intersection of Israel, tech, and Corona. This is a website that you all are welcome to come to visit. And it basically, this is not the website, this is the website, sorry, this is the website. There are all kinds of information and links and the technologies, etc., some of which you're going to hear from today. We are doing these maps that help you sort of figure out what's going on in Israeli tech related to Corona. This is sometimes useful. So as usual, Startup Nation Central, which is a nonprofit that is focused on Israeli tech, is happy to help anybody navigate this ecosystem and assist with any questions related to technology.
Professor Kandel, we have to conclude because we are already late, and we would like to start a Q&A session with you. So please, you can write your questions inside the chat box, and we have already one question by David Siegel. David, can you please unmute David?
Yes, Eugene, thank you. Thank you very much for your fascinating presentation. Maybe you can share with us some of the hurdles that Israeli companies face when operating in Europe and how we can help them overcome these difficulties.
Well, we don't have any specific hurdles for Israeli companies in Europe. In fact, in the last 3-4 years, we've hosted in Israel a very large number of German, French, Italian, British companies, and everywhere else from Europe. And many of them connected very well to Israel. The problem of companies in general, especially sort of more conservative companies, is that dealing with open innovation rather than with this tendency, traditional tendency of doing things internally or coming and acquiring a company and then making things internally, is sort of clashing. And so that's why when it comes from the CEOs of companies, when it comes, I can give an example of AXA, where the CEO and the chairman are coming to sitting with small companies and really bringing all their management with them, sort of driving this process into the company, the results are incredibly good for the company and of course for the ecosystem, because they basically start explaining to the companies what their challenges are, and suddenly a lot of interesting ideas starting coming out of woodwork.
Thank you, Professor Kandel. I believe we had a question by Andrea Carignani from the European Union delegation in Israel. Andrea, do you want to ask your question?
Yes, I have a series of questions, but considering the time constraints, I'll try to be short. I work for the European delegation, and I am the science counselor. So our job basically is to promote the cooperation between Israeli companies, innovators, and researchers in general with European Union's actors. Our cooperation is basically channeled through the framework program, Horizon 2020. We are now scouting and looking at specific initiatives, Israeli initiatives that are particularly promising to fight the corona crisis. We are going through them. We have seen that Israeli companies are really active in treatment, drugs, and vaccines. We have identified some of them. As was said before, it's true that some source of funding come from also European organizations, such as the European Investment Bank. We have identified 3 or 4 of them. My question is, how do you think we could not remove, but limit the burden for the commercialization in Europe? Also, as far as the regulations are concerned, how we can better allow that clinical trials are also done in Europe? Because our fear is that because of the framework conditions and because of some other burdens, we will not be able then to cooperate efficiently with Israeli actors. It's more for the European discussion, so it would be good also to have from the analysts that will follow an answer, but it's just to bring forward some reflection together with you.
So Andrea, first of all, let me suggest that we take the string of your questions offline. We would be happy to, you can contact Emma or anybody else, me, and we would be happy to assist you. I can answer your question in one. There are two answers to your question. There's an Israeli side and the European side. I'm not sure how can we help with regulation and approvals on the European side, but we are happy to discuss this with companies that actually manage to do that. On the Israeli side, SNC, and I'm sure ELNET would be very, very happy to assist you. We have made lists of companies that are relevant for Corona in a variety of ways. We've made the list of companies that Israeli government is using. One of these companies or a couple of these companies are going to talk a bit later after the initial session. And so we stand ready to assist you. You don't really need to walk around Israel and look for companies. We can do it for you. And so that's basically, so I'm suggesting just use us.
Thank you very much, Professor. So we'll go to our second speaker, MP Jatzombeck. The floor is yours for a briefing on the German and European innovation strategy towards the corona. Please.
So, thank you for giving me the opportunity to speak here, and a very warm welcome all over Europe. I heard there are participants, and especially to Israel. And so I can talk about the German perspective. Maybe that might differ in other different European countries. As you know, every country has its own problems and its own strategy. And let me first say something about the situation in Germany. We are hit very hard by the virus. So in the end, our economy is pretty down right now, and we made a lockdown like other countries. It was not so strict as you might have seen it in Italy, for instance, or in Spain or in France, because we allowed our people to go outside all over these last weeks. And to be honest, Germans love to have fresh air and to get outside. And so, but we told them they have to keep distance to others. And that worked quite well. Our numbers got down, and thanks to God, in the end, we could make it without having a capacity problem when it came to our hospitals and intense beds. So the situation is hard, but comparatively, it's okay. And now we are facing all this economy outcome, and also the question, how can we open up this lockdown? And that's the point where technology comes into place. So what we are working on is a tracing app to find out people that are involved in coronavirus. And I think this is something that's very important all over Europe. We have a very strong focus on privacy on that. And we also wanted to enable an interoperable framework so that you can access the same data if you're coming from Germany or from the Netherlands or from Belgium or whatever, because we have so many borders around Germany and people traveling around that it's important to have an app and a framework behind that works all over Europe. And so the system for that is called PEPPT, that stands for Pan-European Privacy Protecting Proximity Tracing. And this technology is not used by every European country, but a lot of them are engaged in that. And so it's important for us to use Bluetooth as a standard to recognize people that has been in contact with you, and not to take global satellite navigation data, because via Bluetooth you're more exact and you have the advantage that your privacy can be better protected. We see some kind of cold start when it comes to digitalization in Germany, because a lot of people in Germany look at Israel and say, so you're a startup nation and technology nation, and so much things are going on online, and maybe it's the downside of the economy success of Germany that we are not in upfront when it comes to a lot of digital questions. But right now we're using video conferences, so to say, overnight. We are using also e-learning platforms and all this kind of stuff. And so we are starting very rapidly here right now. Also, when it comes to the health system, it's not only about this tracing app. We have made a new law that makes it possible to make video consultation at doctors. Only on a single day in March, we had more than 50,000 video consultations on this single day. And another example is that we implemented a software by Robert Koch Institute and SAS, and that gives a real-time overview of occupied and free intensive care beds and ventilators. And nevertheless, we allow the doctors to prescribe apps if they can help it, and the assurances are paying for this. So we have a lot of things that will implement e-health here. And when it comes to the startup ecosystem, we are engaged for several years with public funding. We are investing right now 4 billion euros to help to subsidize or to co-invest for startups. We are increasing in this period these 4 billion euros to 8 billion euros. And we're going ahead with a new concept, the Zukunftsfonds, which will bring additionally 10 billion euros, so that in the end we will have 18 billion euros out there to make co-investments for startups in Germany. And I guess a lot of you are looking at the hotspots that we have, like Berlin, Munich, Hamburg, the Rhineland, and others, and see that a very strong startup ecosystem is growing out there. And when it comes to the problems of the situation, what Professor Kendall said is pretty similar to the situation that we see in Germany, especially when it comes to startups. It's complicated because they cannot go to a bank and to ask for a debt. And therefore, we are implementing mechanisms that are quite similar to the ones that are heard right now. And so we are planning an additional program with 2 billion euros to help to finance startups in this Corona crisis. And the first thing that we are investing in is a matching mechanism where we can make co-investments for up to 70% to investors to help to bring new fresh money to finance into startups. And we also make an additional program for the smaller startups to help them with almost up to 90% public money that we can invest with a 10%.
We have to conclude for this part. Thank you very much, MP Jason Beck. Stay with us for the Q&A session that will take place after the third speaker. So now we will give the floor to Professor Helborn. Professor Helborn, you have 5 minutes to brief us on the situation in your medical facilities, and please try to emphasize, especially on innovation and needs that you can see from the ground.
Thank you very much for inviting me and sharing with you the experiences we have had over the last couple of years. MP Jassenbeck was so kind to already introduce into the German situation. Basically, first I have to set the record straight for Asklepios. We are not the largest private hospital company in Europe, but we are definitely one of the largest. There's another competitor also from Germany, which operates hospitals in Spain, and I assume they are a little bit bigger. Nevertheless, Asklepios is probably the biggest family-owned hospital chain in Europe. Anyway, innovation in this, let's say, very demanding time frame of the last couple of weeks has been playing a major role. Besides quality and social responsibility, innovation is one of the pillars of our company. And I must say that I'm deeply impressed by the innovative moves of our employees in the last weeks. Let me start first of all with the guys from the purchase department. So what they have been doing has been pretty innovative in terms of finding new markets, in terms of assuring that our employees in the standard care units, in the outpatient units, also in the operation units have been equipped with security material, with masks, with gloves, and also, of course, with detergents for sterilization. So basically, this has been a major job, and we have found a couple of new providers, and I must say that this has been pretty innovative from their side. Innovation also, of course, has played a major role in our emergency rooms. From the very beginning, we had to separate patients who had symptoms which were suspected of corona infections of COVID-19. So from a logistical point of view, we had to separate pathways in the emergency rooms. We had to at least separate patients for a considerable time, because the PCR analysis takes roughly between 3 to 4 hours. So it hasn't been, let's say, too easy to get these patients separated. We had to strictly divide our ER departments into restricted areas for corona-infected patients and those who were presenting without these typical signs. Therefore, innovation has also played a major role in the emergency departments. And of course, playing or dealing with the severely ill patients, which we've also seen in the last weeks, it has been also a major and very innovative move to provide our intensive care units with an increased number of ventilators and other, let's say, equipment which is necessary on an intensive care unit, like dialysis machines and other, let's say, less invasive ventilators. And it was also very innovative to, let's say, get rid of patients who had been blocking the beds which needed to be reserved for COVID-19 patients. Like MP Jarzenberg said, the situation in Germany is a little bit different from the situation we have seen in Italy or Spain and also in China in terms of the number of intensive care unit beds. So in Germany overall, also after the increase of beds, we provide roughly 30,000 beds, and not all of them are in use these days. The same holds true also for the regular care departments. So we have basically a number of between 50 and 60% of provided beds, which is only used these days. So the economic breakdown is also taking place in the hospitals, and we are in some hospitals on short work, and basically the demands are also, let's say, pretty tough for hospitals. With regard to digitalization and innovative methods, of course, also at Asklepios, we have been heavily using tele consultations for our outpatients, but also within the company, like consultations between the management board, consultations between the physicians, and also video-based tumor board, for example, or video-based radiology rounds. So this has definitely dramatically risen over the last couple of weeks.
Professor Elbow, we have to conclude and go to the Q&A session, so please stay with us. We have a first question by a journalist from Globes, Uri Berkovic. Do you want to ask your question? I believe you have a question to MP Jarzenberg. Ivan Levington.
Hello. The question I was hoping to ask from MP Jarzenberg was just about the additional $2 billion in funding for startups. Is there any expectation on when that might be approved, when the economic and finance ministries might agree on who will pay for the package?
I awaited that question from Bloomberg, as you written an article about that some days ago. So in the end, I have to say we are moving very much, very fast forward. There are a lot of programs which would normally take 12 to 18 months to implement, and now we're implementing them in weeks. And therefore, in this case, we are in the last steps for the content of the program and for all the details that are necessary, and they will be finished in the next days, I guess. And then we have to solve this financing issue. That's right. But I'm not the right one to answer this. Maybe you present that question to the Minister of Finance.
Okay, so we will ask again, Uri Berkovic. Do you hear us? Do you want to ask your question?
Yes, Mr. Parliament member, you just said that initially your plan was to inject 4 billion euros to startup ecosystem in Germany, and then this number evolved to 8, and then in addition another 10 billion euros.
Yes.
What is the gap between the time that the decision was made and the time that the startups are actually going to actually going to get the funding? And the second question is, what kind of obstacles have you encountered during this process? Because I read that there was some differences in deciding which body is going to pay this money. Because I'm asking not because we see the same process, slow process in Israel, and we would like to know how it works in other countries.
Yeah, so I have to say it works quite well. All the numbers that have been given to the market were completely used every year. And the 4 billion we had in the period before, and the further 4 billions are coming in several steps right now. Most of it is already in the market. And we have, in general, we have 4 instruments for this. 2 are indirect and 2 are direct. So we have the EIF, and the KfW Capital, and they're investing into funds. And so they make a due diligence of a fund, and so they make a contract with them, and this can take up to a year. But in the end, the fund has additionally 25% or something like this from our instruments, and then they can place all their investments without having to ask. They can do with the money as if it would be their own money. And so this is in the end, in the beginning, the point of certification is intense, but it has to be. In the end, they are very quick in making investment decisions. And the 2 direct tools are the High-Tech Gründerfonds and Coparion. And High-Tech Gründerfonds is investing. They have right now invested 900 million euros in seed and in Series A. And Coparion is for Series A to B. And now the instruments that are upcoming are going to invest more in later stage. So that's where we see we have a gap to fill. We have very successful startups here. I've seen in the last year several unicorns that raised half a billion euros. But in most of these rounds, we had capital from overseas. Yeah, and we also want to attract the German insurances to invest in Germany. Some weeks ago, I learned that German insurances are investing in Israel startups. So that's a compliment for your economy. But we also would like to see them to invest in German startups. And therefore, we are building some tools to bring them to that.
Can I just a follow-up question to make sure the sum that was invested by the government last year in 2019 was 4 billion, and due to...
No, it's a total amount, so to say, the fund size over these years that is already invested in companies is 4 billion euros. So to say it's 900 million by High-Tech Gründerfonds, that 3 funds, they are completely invested. Now we're planning on doing a 4th fund, and so there's the fresh money coming up. So these 4 billion are invested already. The next 4 billions are going to be invested over several steps. There are also programs which have some 100 millions per year and go over 10 years. And these 10 billions I've spoken about, we're working on to bring them this year or maybe next year to the market. But and not last the whole year,
comparing to a normal year.
Sorry?
And how, I'm trying to figure out how much is it? Is it an addition comparing to what's invested in a normal year? I'm interested to see what is the Corona's delta.
That's nothing. That has nothing to do with Corona. That's our startup strategy. That has nothing to do with Corona. When it comes to Corona, we have this additional 2 billion euros where we make an additional invest most of the time to companies we already invested in with all these other instruments, and where startups need fresh money, and therefore we have these 2 billion euros, but they are part of these 10. Maybe too complicated explained, but I hope you understand.
So the delta is 2 billion due to coronavirus.
Yes.
And this is something that was flown into the market altogether, or it's in stages, or is it cash and guarantees, or just cash?
So that's what we are working right now on. That was the question from Bloomberg. So the money isn't already there. We always said we want to implement it in April. So we have some days left, but we have to hurry. Yeah, and maybe it will start in the beginning of May. I cannot tell you, and therefore it's a combination of guarantees and of fresh money.
Okay, thank you very much, MP Jattenbeck. I see we have other questions also to Professor Elborn, but the problem is that we are already late on the program, so we will be sure that after the conference we will make the question arrive to the speakers. So now I would like to give the floor to Emma Verdimont from Startup Nation Central for the second part of the conference and the presentation of the companies. Please, Emma. Take the lead.
Thank you, Yossi, and thank you for ELNET to organizing this video conference. As Professor Kendall mentioned earlier, Startup Nation Central accumulate knowledge about what's happening in the Israeli ecosystem and publish regularly valuable report based on it. You can find that was shared with you in the chat, the link for the COVID-19 website, the CoronaTech website. I would like just to mention to MP Yarget's, sorry, to the last one about the Hamagen, the Shield. It's an application, an open source mobile application that is helping social distancing and also to be in contact with who has spread the virus. It already exists in 6 languages, so we can also give more information about that. We invite you to enter and browse the CoronaTech website and share also your challenges there and try to browse for active solution. Now I would like to introduce the first startup in the field of prediction, prevention, and privacy. Alon Kaufman, co-founder and CEO, is presenting Duality Technologies, a leading provider of privacy-preserving solutions, enabling secure collaboration and sensitive data in regulated industry. Please, Alon.
Thank you. Thank you very much, ELNET and Startup Nation. I assume you can see me well and see my slides, so I'll just continue. So indeed, Duality is one of these companies that actually took our solution and converted it to help fighting COVID-19. We are a company that enables, by definition, entities to work together on data and derive insights and value out of data without violating privacy concerns and without the need to have like inherent trust. And so I like invest 1 or 2 minutes on Duality and then talk about our actual solutions that we converted to Corona and being deployed. So very quickly, the pain we solve. I assume, and we've even heard from our previous speakers, we all live in a world that we want to combine more data together and work together on the data to provide more value. So just imagine you could pour all the coronavirus information from all the world into one place, have all the right doctors and so on look into it. Obviously, we could derive much more value and much quicker outcomes. But this, of course, requires the different parties to work together, share their data, share their insights, share their know-how. And we require trust. The challenge that we live in a world today where this digital trust just doesn't exist, unfortunately. And we have a lot of privacy rules and regulations that actually protect our privacy, but at the same time limit this. So we will live in a world where there's like inherent kind of contrast between the desire to work together and derive value versus the need to, of course, protect privacy, security, and even ethics. And just imagine today, if there was no trust challenges, and if you could really share everything together, how much better we could do things that my previous people spoke about, remote health, proximity tracking, and so on and so forth. But we don't live in this ideal world. We're actually in a world where, for the first time, I think, trust and security and privacy is actually really competing with kind of public health. Now, the whole idea behind Duality is that we know to solve this problem. We have advanced technology that can basically enable organizations to work together and derive insights from data and provide insights out of data without the need to access and see the actual raw data. So the whole idea behind Duality is like, in a simple analogy, you can eat the cake and keep it whole. You can allow entities to work on data and at the same time, not without a need to reveal it. Now this technology, and this is like a very quick snapshot of Duality, is something called homomorphic encryption. I obviously won't go into it, but this is a new wave of encryption technologies. And Duality was founded a little more than 3 years ago by world leaders in the space, including a Turing Award winner. And we basically provide data science capabilities on top of this homomorphic encryption platform that we've developed, offering exactly these types of solutions, which in the last 2-3 years, because of the uprise of the need of privacy, and GDPR has a huge role there, because of the extra investments in RegTech, and because companies really see this kind of challenge of working together, but still meeting privacy and security concerns, this whole field has really had a very nice period with a lot of boosts. And Duality is basically the first company coming out with a commercial solution to do this. What do we actually provide, and how does this meet what we're doing within the COVID space? So we basically have 3 products on our platform. And I'll give you very quick examples of how we actually deployed them and how we converted them to work in COVID. In general, we use these solutions in financial markets and in healthcare markets, and we converted it now to specific COVID. So the first model on the left is what we call secure data analysis. This goes to some of the examples Thomas gave about using remote apps, or maybe robotic diagnostics. We'll go into it later. But this allows an entity or a person or a healthcare provider to basically use a model from a third party without sharing the data. Or we've all seen what happens in China, which of course is scary in terms of privacy. That would enable the governments or the healthcare agencies to provide a contagious risk score without the need to actually have access to the raw data. The second kind of model is allowing an entity to analyze data that doesn't belong to him without revealing or seeing the data, but yes, getting insights out of it. And this is typically what we offer around the privacy preserving contact tracing offering we provide, which allows health agencies, governments to understand who's at risk, to understand what areas are at risk without ever disclosing who is sick and without getting access to the raw information. So different from an opt-in solution, this is a solution that the health agencies and the governments can actually analyze this data, but never have access to the raw data, just have access to the insights. And our third kind of version is what we do.
I'm sorry, we need to conclude. If you can make just one last point.
Yeah, so the other one is really combining data sets from multi-centers to analyze it together. And with this, I want to really conclude and say that we've gone out with a campaign reaching out to the industry to offer our services, to work with them together in all the healthcare ecosystem to provide our solutions to help fight this COVID in a collaborative way, but by preserving trust and privacy. Thank you.
Thank you, Alon, for this presentation. Right now, I would like, in the field of remote monitoring, Miki Raviv, the founder and CEO, will present you VITALERTER, remote and contactless monitoring capabilities that act as a virtual nurse, helping care teams to check remotely and in real time residents' and patients' conditions. Please, Miki, are you with us?
Yes, do you hear me?
Yes, we hear you. Thank you.
Okay, good. So hi, everybody. VITALERTER is concentrated on the area of continuous remote monitoring, but also protection. And let me put here a thesis. By bringing the power of artificial intelligence technology with autonomous monitoring, that's something that can dramatically improve and prevent care for elderly people. A current problem that are existing, and I think the COVID-19 even make it more relevant, is that we have too many emergencies, and that's because, you know, such type of epidemic is uncontrolled, that causes to a delay for the care staff to respond. The current monitoring solutions are intrusive, and it's difficult to monitor and predict patients with the infection diseases. Again, not just coronavirus, but we talk about some other types of viruses like sepsis, which is one of the most popular ones. And again, it's the solutions are obtrusive, limited in mobility, and high cost. And by having an ability for early detection and prediction of patients' health deterioration, we can improve personal health and the quality of life. VITALERTER have developed an integrated, unique platform that is a combination of two core technology. One is a unique contactless biosensors that convert any beds, any wheelchairs, sofas to smart by putting below. And the second part is that each of these unique biosensors is connected real-time using standard Wi-Fi to the cloud. And there we have our machine and deep learning algorithms that analyze, predict, and prevent. And the value proposition in order to improve care and quality of life that VITALERTER brings are early detection and prediction, better response time. Actually, we prioritize the staff, the health staff activities. Solution is contactless, wireless, and actually it's virtually no intrusion, virtual nurse. Cost-effective solution, very easy to make it high scalable. And the last and important one is the ability to detection of infectious disease. The top 5 digital health as brought by Forbes technologies in 2019 are including big data analysis, AI, mHealth, wearables or nearables like we are doing in cloud, and VITALERTER is actually has the expertise in all these top 5. We got last year a very prestigious, we won very prestigious tender led by the Ministry of Health of Israel, and jointly with Deloitte, we start providing our solution to about 50% of the Israeli aging market, geriatric hospitals, nursing homes, which the total project is about $30 million in the next couple of years. Actually, VITALERTER went market about more than 2 years ago, and we found ourselves with presence, footprint in 4 continents, including Europe with chain of distributors, South North America, USA, Asia, and even Australia. And you can see here a list, and probably you'll see your countries here in. A very strong team from the artificial intelligence, health, digital health algorithms, and the marketing. And that's the solution. As I told you, it's a composition of a light box size biosensors that by touch below bed, below wheelchair, we monitor the patients contactlessly. Each of these sensors connected to our AI, which is running 24/7 in order to learn continuously personal health profile, look for patients' health deterioration, predicts deterioration, and send to any mobile apps or web-based on desktop dashboard preventive alerts. The type of proactive and preventive alerts you can see here, we customize, of course, the solution to the aging care market, which we all know that it's a big issue in nowadays. And we all about to prevent. We prevent falls, we prevent pressure ulcers, we prevent sepsis. Sepsis, again, it's a blood disease, one of the highest killers in long-term care facilities. And we do detect such special symptoms related to sepsis in order to send preventive alert and continue with heart rate, irregular breathings, etc. And what we have done for the corona is that because we have the ability to continuously monitor the patient's key vitals, including fever, movement, heart rate, respiration rate, etc., and we have the AI that gets and analyzes all this data, we now build a special module that analyze the COVID-19 symptoms, which include fever, cough, and some breathing deterioration. And we have the ability not just to send predictive preventive alerts, but also to continuously monitor those patients and see what's going on. I think you can see here in this dashboard, which that's what the staff is in the hospital see in order to analyze and prioritize the situations. Yes, please.
Yeah, I'm sorry that we have to conclude, and we have one question that is actually asked towards Professor Kendall before we continue to the next startup. Please, Mickey, make sure to share in the chat your email and any connection that any people that would be interested in to hear more about your solution can directly contact you, as well for all the startups that are presenting. So we have a question from Pierre Heumann for Eugene, for Professor Kandel. What are the effects of the foreign investment crunch? Are startups going to be out of business, or how can the missing capital be replaced without relying on governments? Professor Kandel.
Well, I actually wrote an answer, so you can you can look at my answer in the chat. But I believe that it can't be done without for two reasons. In principle, it can be done if the institutional investors just go in and replace the foreign capital, which has been a dream for Israeli policymakers for the last 11, 12 years, even more. But unfortunately, during the crisis, it's highly unlikely that institutional investors who just bled from the traded markets and are considering this to be a very risky period are going to go into tech investments without some support. And so the idea was to provide downside protection, so to de-risk it for them, and to basically show them that it's a very low risk but high return. So it's almost like an option on the tech market. And we hope that with that support, we're going to actually induce them to invest, because otherwise I just don't see any way for this capital, which is like, it's not like 10% decline in capital, it's 85% decline in capital. And I hardly see it being replaced by anybody else.
Thank you, Professor Kandel. So we move to the next startup. As a result of COVID-19, addressing social isolation and mental challenges is in great need. Uniper Care Technologies Android-based set-top box turns any TV into an engaging platform and was selected by hospitals, HMOs, Health Ministry, and Welfare Ministry. Rami Kirschblom, co-founder and CEO, will tell you more about it. Rami, you're with us.
First of all, thank you so much for, can you hear me?
Yes, we can.
Thank you very much for giving us the opportunity to present, for the organizer, ELNET, and Startup Nation Central. Very pleased to present and show you more about what we do. So I'm Rami, CEO and co-founder of Uniper. Uniper, we started addressing social isolation back in 2016. Just in the US, there are 50 million. It's nearly 50% are suffering from social isolation and loneliness. And by now, everybody knows that it's the root cause of diabetes, depression, high blood pressure. Everybody can, witness it firsthand by being now quarantined during the COVID-19. And it's equivalent to smoking 15 cigarettes a day by ARP in the US. So Uniper addresses, there's alignment of interest of everybody. Older adults, family caregiver, and the government. Everybody wants to keep the older adults and the seniors at home and within the community, and to push nursing home hospitalization away. The problem is that if they are staying at home, they are socially isolated, they are lonely, and very soon their health deteriorates. So in Uniper, we're basically providing a solution to reinvent the way people age at home, empowering older adults to be socially and physically active at home. We are a tech-enabled service, building the largest senior living community at home. We're trying to mimic a senior living environment, but at home in an affordable way and in a scalable way. So when we started, we saw people watching TV 6 to 8 hours a day, feeling isolated and alone, and we said, why to fight it? Why not to take a technology they're already used to and turn that into an interactive community? We are now cross-device, but obviously for the ones that are less tech-savvy, the TV is the one that is most accessible. So it's a box connected to any TV with a simplified remote control and a camera that turns the TV from a passive device to an interactive device. And when we build the senior living community at home, we'll basically have three major components. One, it's accessible. The TV is one example. Now we have it on mobile phones, tablets, and desktop as well for the ones that feel more comfortable with technology. Be it social interaction. So you have, like in the senior living, we are providing our health coaches and facilitators are providing yoga sessions, fall prevention program, everything in order to increase healthier lifestyle and preventive care, and to make you feel and create new connections and meet new friends. And it's personalized. We have AI engine that builds based on subjective and objective measures, the ability, your mental, social, and physical profile, and then personalizing the service. From a technology point of view, it's holistic. For the older adults, it's cross-platform, very easy to use. No need to change, if the TV, no need to change the input in the TV, as an example. We have a caregiver app, and then behind the scene, we have a caregiver and care provider web application that allows us to deliver personalized care, but also function by our health partners as a full telehealth solution to deliver care to the ones that are costing the most in the healthcare system. It's not just about our facilitators, it's about community-generated experience. So our users are meeting new friends, everything is live and interactive over video calls, and part of the experience is basically to encourage that. This is a daily schedule, you know, it's much more condensed than that, but each one of our live and interactive sessions and also recorded content that we produce is in order to increase the outcome and to improve the health outcomes of older adults. This is our focused outcomes: reducing social isolation and loneliness, fall risk reduction, and mental aspects of anxiety and depression. We have a lot of content, evidence-based content around that, and general health education. You can look at taking the best of senior living and making it available at home. You look at it as a Maslow pyramid. We started with socially and physically active. We also have medication reminders, full telehealth solutions, and recorded and live sessions to promote preventive care. Safety, we are integrating different safety measures for monitoring purposes, and also the ability to order services from the comfort of your home. As a telehealth solution, we have remote interventions, remote identification, and many other capabilities that are being used by our health partners in order to deliver care, full GDPR compliant, HIPAA compliant, and so on. It works. Our users, the engagement is what's the most compelling. They are using it a lot because now they are part of a club, social club, a community, and now they are spending a lot of time, and that's what drives the behavioral change that actually helps in studies we have done in the US and in Israel to measure reduction in depression, loneliness, and saving costs to the healthcare system. We are operating in the US, Israel, and Austria. We are working with health plans, home health, mental health providers, senior care, any organization that serves seniors and older adults and wants to keep them at home and within the community. Just to emphasize in regards to COVID-19, that all the pre-COVID-19 conditions will, reinforce during COVID-19. We were addressing that before: social isolation, mental challenges as a result of being isolated, the need for fast setup and simple to use telecare, and focusing on the ones that are at risk, which are the older adults. That's the reason we've been embraced by the welfare ministry, by municipalities, by hospitals, HMOs across Israel, and also in the US by POs, health providers, and senior care providers.
Thank you very much, Rami.
Yes.
We will make sure to put you in contact with anyone who has more questions for you. We'd like to have more details. We'd like to invite, sorry?
Sorry, Emma, I believe we have a question to Professor Herborn that was not asked. If we can take a few minutes just to ask the question. It's the question of Mr. Wusner, Eckhard Wusner. Can you ask your question to the professor?
Yes, we're all thinking about the actual situation and perspective. So as early as possible, we come back to the situation as it was before. I think it's the best way also to talk about startup companies and else. And there is a product which is globally available, produced by 4 companies, which is very simple. It's gamma globulin. So these gamma globulin, so it is a monoclonal antibody product, is able, this is a perspective which might be true, is able to secure intensive patients to survive. If this is the case, and this is available globally, we have something which we can use in between before we have a real vaccination. So I just want to ask him if he has in his clinics any results by using this gamma globulin.
No, so far we haven't used any of these antibodies. Basically, we are also using, let's say, the best medical care as the standard treatment, like for all virus pneumonias. Currently, we are learning that COVID-19 is not only pneumonia, but it's basically obviously also a vascular disease. There have been interesting agents like remdesivir or hydroxychloroquine, which are currently evaluated by major university hospitals. Within our institutions, we just started plasmapheresis studies, which basically deal with antibodies which derive from patients who have undergone and survived COVID-19, but this is also the very, very early stage, and the use of regular IgG antibodies has not been evaluated in any of our hospitals.
Okay. So if there are any new information, please keep me in touch.
Yes.
Okay, thank you very much, Professor Herborn. Now we're moving to our next presenter. Diagnostic robotics. In March 2020, the Israeli Ministry of Health developed a COVID-19 strategy that includes a daily nationwide monitoring of coronavirus-related symptoms of the population using diagnostic robotics, digital risk assessment and monitoring platform. I'm very, very happy to invite Kira Radinsky, Chairwoman and CTO, to join us to tell about their AI diagnostic system. Please, Kira, the floor is yours.
Thank you so much. Hello, everybody. Diagnostic robotics has existed for several years, building clinical triage systems, first to reduce healthcare loads inside emergency rooms, work with the largest hospitals in Israel, in the United States with the largest hospitals. We then extended our solutions to also work in primary care, working with 3 out of the 4 HMOs here in Israel and being deployed to 40 million members in the United States. 2 months ago, we've been requested by the Israeli Ministry of Health to extend our solution to triage and monitor COVID nationally for Israel. On a daily basis, our system monitors 8 million patients, and we collaborate with all of the HMOs, Israel 911, called MADA, and the hospitals as well. What we provide the Department of Health is an epidemiological map showing them where COVID is right now, but most importantly, how it's actually gonna spread. We use different machine learning models based on collected data in order to actually predict the spread. How are we doing this? Every patient in Israel is getting a link via text message from their HMO, getting them to a web page where they go through a clinical triage for COVID. At the end, it actually gives them directions, but most importantly, this information helps us understand the symptomatic load in different locations in Israel. Everything I showed right now is completely anonymous. One of the HMO also decided to make it non-anonymous for patients at risk. We built models based on information we received both from Italy and South Korea, predicting who, if they have COVID, will deteriorate. Those populations get links which are not anonymized, and if the system predicts that they're gonna have COVID based on their symptoms, a red flag is sent to their care manager that can call them. So just summarizing how the Israel digital nationwide triage system works. Either me as a patient, I get a daily link for monitoring. I can be healthy or not. Or I'm just worried, for example, I'm calling Israel 911. While on call, I'm getting a text message asking me to do this questionnaire in order to reduce loads from the call centers. I do the questionnaire, If I have no COVID, I get an all clear recommendation. But if I do, I get a message telling me to contact a call center. And if not anonymous, then my care manager will also know about the fact that I'm sick. But the most important thing, the Department of Health right now has a holistic view of an epidemiological map about where COVID is right now, including projections to the future. The value it provided for the population is increase in adherence to public health guidelines. On a daily basis, they're being reminded about isolation, the symptoms. For the health system, it reduced loads on call centers by approximately 30%. But most importantly, it kept the safety of the actual personnel. Before that, we had entire departments being closed because of a single COVID patient. Now we're doing the triage remotely. The governmental agencies decide on a daily basis based on these reports whether they should quarantine a city, where to send additional COVID tests, but even more interesting, starting from this week, which cities to release. So just a quick numbers. 25% of the population in Israel fills in the questionnaire at least once a week. We have completion rates of around 83%. The actual reports provided to the Minister of Health is this is how many patients said that they had done a COVID test, which came back positive. This is the numbers reported by the Minister of Health. And here is how much the system predicted that they're gonna have. This city specifically was designed for quarantine a few days later based on the predictions of the system. Where additional death flow, specifically in small villages, were identified, where the Minister of Health was not providing the tests, but they were done privately. For example, here, many patients provided the fact that they'd done a COVID test, which came back positive. This is just an example of the type of predictions we were able to make on the media. In April 4th, we announced that Migdal Tiberias and Ashkelon having a high symptomatic load. And indeed, a few days later, the government decided to quarantine the cities as well. Here I'm going to show two examples of two cities. The system predicted at this point that they're going to actually have very high symptomatic load very shortly. Here we see that it actually started increasing. At this point, this city received low intervention. Low intervention meaning not too many COVID tests were sent. Compared to this city, where the system predicted and the government decided to increase the number of tests significantly. Here we see that the curve has become pretty stable, where here it continued growing, not in the same pace as before. The system has gone live today in India, in Odisha area, serving 50 million people, and additionally in the United States through a collaboration with Rhode Island. The system itself is very customizable. It's up and running in a day, and we support multiple languages. And here my ask is, we supply the system at no cost. We're only asked to cover operational cost. So if anybody here on the call has a need of the system, because we're gonna have COVID for approximately at least a year. And this is the only way that Israel identified that it can have a control panel on the system. So please do feel comfortable contacting me. My information is here in the chat.
Thank you very much, Kira, for that. What we want to say also is that this session is recorded and will be published. We will be happy also to share the presentation of the startups with whomever want it, also from Professor Eugene Kandel. I would like to invite David Siegel, President of ELNET, for the closing last words, and thank you. And thank again, ELNET, and we value very much the partnership with you. Thank you all.
Thank you, Emma. And first of all, thank all of you for joining us today. There are a lot of thank yous. This is a great partnership with Startup Nation Central. We're very thankful for that partnership. And this is the first in a series of programs that hopefully we will offer together. And we invite your feedback so that we can always improve as we go through these weeks together. ELNET is an organization that is dedicated to strong Israel-European relations. And we also believe very deeply, as Professor Kandel said, that only through international cooperation will we be able to overcome this pandemic. and we hope to do this together with you in the weeks to come as we offer more experts and companies and technologies that we can share together for the benefit of all of our communities. We hope you enjoyed this program as much as we did today. We look forward to seeing you again in our next workshop. And again, thank you to our teams for putting together this incredible program. And we hope to see you very soon. So be safe and healthy, and we'll see you next time.